on a 2013 webpage titled Panic Disorder in Children and Adolescents. The American Academy of Child and Adolescent Psychiatry says more than 3 million Americans will experience a panic disorder at some point in their life. Today I'll be talking to you about panic attacks, also known as panic disorders. Specifically, I will tell you first about the symptoms and long-term effects. Second, who are affected. And third, the treatments for panic disorders. Now that I have covered what we'll be discussing, let's go to the first thing: symptoms and long-term effects. According to the 2013 webpage titled Panic Disorder in Children and Adolescents, the American Academy of Child and Adolescent Psychiatry says that symptoms include intense fearfulness, racing or pounding of heartbeat, dizziness or lightheadedness, shortness of breath, trembling or shaking, or losing control. Now, with the shortness of breath comes along a symptom most commonly related to a heart attack. It's the pressure on your chest that makes it feel like you are unable to breathe. Now, panic attacks can be brought on by a person's specific fear, such as the fear of talking to others. This is known as stage fright. If you have stage fright and you are told that you have to go give a presentation, you might have a panic attack. Now, another thing about panic attacks is many of them are hereditary. If your parent has a panic attack or has a panic disorder at one point in their life, had a panic disorder, then you may get one too. Now, panic attacks have long-term effects if left untreated. One is severe anxiety. On a 2016 webpage titled Do I Have a Panic Disorder? From Aspira, I pulled this. It is called the Panic Circle. Now, it starts up here with anxiety. Then that will lead you to have a panic attack, which leads to fear of another one, which of course gives you more anxiety, to another attack, onto more fear, and so on. Now, right around here is when you will develop severe anxiety. Now, severe anxiety can go on with you through adulthood. Another long-term effect is depression. Many people who struggle with a panic disorder also will struggle with depression at some point in their life. Adolescents treat themselves by avoiding what brings on their attacks. This is called agoraphobia. Now, this can interfere with relationships between family and friends. By avoiding situations, you are cutting yourself off to so much. Now that we have covered the symptoms and long-term effects, let's go on to who is affected. Now, there are people of every age affected. As you can see in this bar graph, every age here is affected. This is 16 through 24, which is commonly thought to be the age of people having a panic disorder. But as you can see, this is the peak, right around here. Now the blue represents anxiety disorders. So here is 16 through 24. This is 25 through 34, which is actually where the most common onset is through 24. And then it carries on throughout their life. Now I pulled this from the 2014 webpage titled Causes of Anxiety and Panic Attacks on Relationship Surgery. And they discussed the many effects and how many people are really affected by it. When adults have anxiety, it can commonly be about what's going on in their life, much like teenagers. With teenagers, they often don't tell others what's going on. They like to keep it to themselves, and because they think it's really not that big of a deal. Now, adults, they are able to seek treatment for themselves. So with that, they get over it later on in life. When they get older, it's gone by it was 75 through 85 is when you see a great dramatic decrease. Now that we have covered not only the symptoms and long-term effects, but we've also covered who are affected, let's move on to how to treat. So, according to a 2016 webpage titled Panic Disorder When Fear Overwhelms, the National Institute of Mental Health says that treated psychotherapy or with medication, panic disorders can be helped. For medications, some of the medications that are seen for panic disorders are also seen used for depression. Now, this again links the two, which shows us that because you have a panic disorder, you can have depression later on. But by using this medication, you are able to get rid of the panic disorder before your depression sets on. Therapists will teach you how to rethink and how to control your emotions whenever something happens that normally triggers your panic attack. So, with all this, you now know what a panic attack is, what the symptoms are, how to treat it, and what the long-term effects are. Panic attacks should not be taken lightly. They can hurt somebody throughout their entire life. With there being so many people that have a panic disorder, chances are you know or will know someone that will have a panic disorder. If you see these symptoms when they have to go do something, or if they tell you that they're not okay, talk to them and try to get them help. Panic disorders affect so many, yet so many go untreated and don't get the care they need. Thank you.